In this section, we will be taking a look at the concept of perfusion. Specifically with perfusion, we are going to take a look at cardiovascular health and illness in relationship to risk factors and prevention strategies for stroke, hypertension, peripheral vascular disease, peripheral arterial disease. And then we will be taking a look at the student learning outcomes of providing safe, patient-centered, evidence-based nursing care for chronic and vulnerable populations guided by the Caritas philosophy, demonstrating critical thinking and clinical reasoning when providing quality care in community-based settings, relating how quality improvement measures enhance patient care and outcomes in the community, communicate effectively with patients, families, and members of the interprofessional team, manage care for clients in groups in diverse settings, and lastly, to practice as a competent nurse assimilating professional, ethical, and legal guidelines. Risk factors related to the concept of perfusion are going to be affecting any of those disease processes that were discussed on the previous slide as far as the hypertension, the stroke, peripheral vascular, and arterial disease. So you can see that it's divided into non-modifiable and modifiable risk factors. Non-modifiable means that these risk factors are not affected by changes in a person's behavior. Modifiable are those that can be changed and altered and improved. For hypertension, take a look in your textbook at table 16-27. It's on page 1163, and it's the classification of blood pressure for adults. You need to know what the normal prehypertension and hypertension categories are. And then, especially with screening in the community setting, you need to know what is going to require immediate treatment. And these are the two instances. Hypertensive crisis would be a display of any of these symptoms. If you're registering high blood pressure, systolic greater than 180 or diastolic greater than 120, you want to screen for additional symptoms because their risk of stroke is extremely high at this point. And then the stroke is going to be any sudden loss of sensation or movement. And then also take a look in your textbook, and you'll see on page 1168 what are the clinical therapies that are indicated for both of these situations. The ultimate goal is for patients to have blood pressures below 140/90. And if they have diabetes or renal disease, it should be less than 130/80. All of these listed are going to be prevention strategies. Take a look in your textbook as far as medication management is concerned. They actually have a nice algorithm. It's figure 16-48, and it's on page 1169 as far as when to initiate lifestyle modifications and then when you initiate medication choices as well. So initially, if you have somebody with an elevated blood pressure, you are going to encourage lifestyle modifications of diet and exercise, stopping smoking, alcohol in moderation. The DASH diet is actually pretty effective. The recommendations are in your textbook. Physical activity should be 30 to 45 minutes per day, 5 to 6 days a week. And any kind of isometric or weight training is not appropriate for somebody with hypertension because it will actually raise their blood pressure even further. Alcohol intake, the guidelines are in your textbook, but it should be limited to no more than 2 drinks per day. For women and people that are a little bit lighter weight, it should be half of that, so like one drink, and you can see the volumes in your textbook. Again, stopping smoking, stress reduction, and then providing education once medication is initiated as to what the medication is for, how it works, what side effects to look for, and to make sure that you encourage compliance with taking medication. If they have access to blood pressure monitoring equipment, to monitor daily to see what they're trending. If they are not able to afford to get their own blood pressure monitoring equipment, maybe to encourage them to go to some of the local pharmacies, even a few times a week. And most pharmacies actually have equipment that they can actually self assess their own blood pressure. So that might be a good idea for those that are the more vulnerable population. You also want to take a look in your textbook, the medication, the hypertension medications, the different classes, how they work, and what are some of your nursing considerations for all of the different classes of medications. So I listed in your syllabus a website to refer to. It's the National Heart, Lung, and Blood Institute, and this is actually a component of the National Institute of Health. They come out with guidelines that are evidence-based, and they are systematic reviews. And they actually rate the level of evidence. So these are some of the recommendations and the evidence that supports ways to decrease the hypertension in individuals, the blood pressure. So you can see by reducing sodium, it can have as much of a 3 to 4 systolic decrease and a 1 to 2 diastolic decrease. Physical activity, and it's defined here that you can look at. Again, an average a decrease of systolic of 2 to 5 and a diastolic of 1 to 4. So even just with diet and exercise alone, reducing sodium and an exercise program, you can have up to a 9 millimeter decrease in systolic and a 6 millimeter decrease in diastolic. So that's really important to know when you're educating patients about the benefits of diet and exercise, to be able to say the evidence that supports that it is effective. And this also comes from the National Institute of Health, and this is saying with by decreasing weight, it will reduce blood pressure as well. So again, a 5% weight loss will actually decrease systolic and diastolic up to 3 and 2 apiece as well. So again, diet, exercise, losing weight has a significant impact on lowering a patient's blood pressure. So you can see that that's why lifestyle modifications are always initiated first, to see if that will be effective before medications are introduced. Hyperlipidemia is another factor that is going to influence the concept of perfusion. Hyperlipidemia is defined as high levels of blood lipids and lipoproteins within the body, and those lipoproteins are what is going to carry the cholesterol within the blood. 3 different components of a cholesterol panel, and that is the low density lipids. Those are your LDLs, if you remember that they need to be low. They are the carriers of cholesterol within the body. So you want those levels to be low. High density lipids, or your HDLs, you want those to be high. These are the component that is going to actually clear the cholesterol from the bloodstream. Levels of greater than 35 milligrams per deciliter are actually associated with less of a risk factor for issues with perfusion, particularly coronary artery disease. And then there's triglycerides, which are the fatty acid, and they are used for fat storage within the body. So you want your overall cholesterol panel, the triglycerides, and the LDLs to be low. Um, when they are, it does decrease the risk of complications with perfusion because the cholesterol is going to stick within the blood vessels and block and narrow those arteries, so it will impact perfusion. Also refer to your table 16-21. It is on page 1110 of your textbook, and it gives you the classification of the serum cholesterol and triglyceride values. Prevention strategies for hyperlipidemia are going to center around the same thing as for hypertension. You're going to want to encourage adequate diet, intake of fruits and vegetables, proper exercise, length and frequency, weight loss, and then if not effective, then you are going to be taking a look at medication management for cholesterol lowering medications as far as education and how to take them, when to take them. If you refer to your textbook on page 1117, there are medications listed, different classifications, the mechanism of action, and the nursing considerations for those particular medications that you want to be familiar with. Again, this information on lipids is coming from that National Institute of Health, and pretty much this is the evidence that is going to support your education for physical activity and for weight loss in reducing cholesterol levels within the body. And you can see the numbers. Physical activity will actually reduce LDLs by 2.5 to 6 milligrams per deciliter. On average, it was around 4. And then those losing weight, that they have a certain amount of weight loss, it will actually decrease their LDLs, increase their HDLs, and also decrease the triglycerides. This, once again, is coming from the National Institute of Health, and this is a chart that they use to determine proper dosing and medication selection for individuals that need to lower their cholesterol levels. We're going to take a look at two perfusion abnormalities, peripheral arterial disease and peripheral vascular disease. They are both caused by atherosclerosis, which is when deposits of fat and fibrin obstruct and harden the arteries, and it impairs the blood supply to peripheral tissues. So in peripheral arterial disease, the issue is that the arteries are going to supply the nutrients and oxygen to the extremities, and if you have an impairment and a blockage from atherosclerosis, the arteries are going to have a harder time perfusing. So if there's a lack of oxygen and nutrients to the lower extremities, your symptoms are going to reflect this. So the pain, the intermittent claudication is when they are performing activity, they're having pain in the lower extremities, and when they rest, the pain is relieved. There will be no edema because their edema is a vascular issue. Again, because we're not perfusing with arterial, the skin color will be pale or normal. The skin will be shiny, hair loss, again, because hair needs blood and nutrients and oxygen to grow. So if you do not have that being supplied, you will have hair loss. Perfusion issues will result in thick toenails. And then the pulses will be decreased or absent. Again, it's all related to the function of the artery, so try to remember it in that way. And then peripheral vascular disease is the veins are going to carry the blood flow back to the heart. So if the veins are impaired, your symptoms are going to reflect this. So the veins are not able to carry the fluid back up, so you're going to have edema. you're going to have resting pain, where if you stop activity, you will have pain, and it's more of an aching and burning sensation. Because of blood pooling in the lower extremities, the vessels are destroyed, and the blood vessels actually, when they are not able to go back up to the heart, they actually release a substance, and it causes a brown discoloration of the lower extremities. Again, the skin will be thick, and they'll have normal pulses because, again, they're able to perfuse down, but they are not able to carry back up. Your risk factors for both are the same. The biggest is the cholesterol levels, coronary artery disease, and the atherosclerosis that occurs, but all of the other factors are going to influence as well. Prevention and management is going to center around decreasing the risk factors. So stopping smoking. Foot care is going to be extremely important because in both arterial and vascular disease, ulcers are very common, different locations, but very common nonetheless. So foot care is going to be important. Controlling diabetes and hypertension, lowering cholesterol, and weight loss will all help. Metabolic syndrome does have a crossover with the concept of metabolism. However, I am including it in the perfusion section because of the risk factors. So it is a group of metabolic risk factors that increase the risk of coronary artery disease. You can see the risk factors are included, and it is caused by 3 factors, being overweight or obese, physical inactivity, and then genetic factors. And the reason why it has a concept of metabolism is that it is associated with insulin resistance. So just so you're aware that patients may be at higher risk for metabolic syndrome, and what it will look like, and that it does affect insulin resistance as well. Stroke is the last issue that we are going to take a look at related to perfusion. And you can see the risk factors, very similar to the risk factors that we have discussed for all the other issues related to perfusion. And then your prevention is going to be very similar as well. Decreasing blood pressure, decreasing cholesterol levels, stopping smoking and substance abuse, alcohol use, and then having good management of diabetes and hypertension. And then also the southeastern United States is usually the area that has the highest stroke mortality. So if you would end up working in that area, just to be aware that those patients are going to be at higher risk, so their education and prevention are going to have to be even increased more so.